Hello, my friends. I hope this video finds you all well. And I'm going to be discussing the role of exercise in cancer. We're going to try to answer the question whether exercise can cure cancer, whether exercise can prevent cancer from coming back. And we're going to discuss the Predict website from England. That's from the National Health Service. And it gives us an idea of where does the cure or treatment come from that becomes the most successful? What is the survival? What are the numbers? And how does that compare with exercise? And maybe other things that we might be using. Because if exercise, which improves health and well-being, can treat, cure, decrease chances of cancer coming back, imagine what other conditions it could help for. And we could reasonably assume that if exercise works, it will work for other situations as well. I want to take this opportunity to honor Andrew Soll. I give my condolences to you, to the family, Colleen, his daughter that I met in Wichita, Kansas once. Wonderful people. And Soll is one of the wise elders of the tribe. And we appreciate everything that he has shared and experienced with us. So we're going to go ahead and share this information. As you can see here, this is the Predict website from England. Very important to put information that you can get in the pathology report about the patient here. And it gives you what are the results of treatments in terms of survival. So in this particular patient, it's a 45-year-old patient, menopausal, estrogen receptor status of the tumor positive, HER2 negative, no hormonal therapy previously. The tumor is 2.6 centimeters in size. The grade is grade 2, detected by screening, no positive axillary nodes. And at 10 years, we can see that surgery provides most of the opportunity for a possible cure in this situation of breast cancer. 89% of those patients that underwent surgery are alive 10 years later. If you add hormone blockage with tamoxifen or anastrozole, it adds 2.5% additional. If you add chemotherapy, 1.9% additional benefit. 1.9 out of 100 patients, 2.5 out of 100 patients. So you see in early breast cancer, which is most of the cases, if you have an adequate screening in the population, it contributes very little to that survival. On the other hand, if we see an advanced breast cancer case, HR diagnosis 38, with a positive ER status, but the tumor is 4.5 centimeters in size, and the grade is 3, surgery at 10 years will yield 39% of the patients alive. I mean, that is a testament that early screening by physical examination with or without mammogram is definitely something that should be done in certain populations. However, the blockage of hormones, chemotherapy, and Herceptin, trastuzumab, may increase the survival. So in these particular cases, very advanced cases, there may be some benefit from these therapies, and it can be justified, but most of the early cases is not as justified. And then we're going to compare physical activity. Canioto did a great paper of physical activity before, during, and after chemotherapy, because it's very hard to do a randomized study where you don't treat half of the patients and treat half of the patients, because we know in general exercise is recommended for almost everyone in the population. So they did a very good prospective study with 1,340 patients and examined this possibility of whether physical activity can add to that survival benefit in breast cancer. Remember that even though it's breast cancer that we're looking at because it's the most common, doesn't necessarily mean that it doesn't work with other cancers. And we can reasonably assume that, yes, it does. And we would recommend it. We wouldn't wait for a study to show that. We would recommend exercise as a benefit. And here are the figures for disease recurrence and all-cause mortality for people that had no weekly recreational physical activity, low weekly activity, moderate activity, and high activity. What was interesting was that the ones that had high activity of exercise had the same recurrence rate and survival as the one that had no weekly recreational physical activity. And that's very interesting because it suggests that we can exceed ourselves with exercise. So there's a middle ground that is very important, and we will discuss what that middle ground is. But basically, the mortality was 20% for patients that did not do exercise or had not done exercise before a diagnosis or after a diagnosis. The ones that did moderate activity, it was highly significant in terms of decreasing the chances of a tumor coming back and increasing survival by an additional 10%, so 10 out of 100 patients. And if you remember what I mentioned in early cases, the chemotherapy and hormonal blockade contributes very little, 2.5 or 1.9% of the patients as an additional benefit in survival versus 10% with exercise. That's amazing. And what kind of physical activity are the ones that they're talking about? Well, the physical activity guidelines for Americans suggest that moderate activity, which is the one that was shown to decrease recurrence of breast cancer and increase survival, was 150 to 300 minutes of moderate exercise a week. And that's roughly 45 minutes of walking 4 times a week. Very simple. So we definitely recommend this to all our patients because it's being shown to increase survival. We discussed these figures with them. Remember, this is from the National Health Service of England, where all the citizens of England are members of this. So that's very good data. It has been criticized because it was done with 3,000 patients and that the prediction was not as good was the criticism. So they repeated this study of whether that website was predictive of results in the future, and they did it with an additional 30,000 patients in England. And it showed even more significance of prediction in terms of what treatment contributes to survival and curing breast cancer. So, in summary, we recommend exercise to all our patients, and not only breast cancer, but other cancers if they're able to. We tell them, start with 5 minutes. When you start feeling better, you're getting to the mood of continuing. And the second thing is that imagine if something like exercise that increases well-being and health can cure breast cancer. Other things that we do, like decreasing stress, detoxification of the things that can cause cancer, good nutrition, organic food, and all these things that we know that can improve, like intravenous vitamin C, definitely have a very good chance of being shown that it increases survival in a randomized study. But we don't wait for that. We do it because we see the benefits in our patients. So thank you very much for your attention. If you want to continue these conversations, you can join my video newsletters, and I'll be happy to connect with you in that regard. So thank you and have a great day. And I hope to speak to you soon.